Series of videos, we're going to be talking about the spinal column. So to think about the spinal column, you want to keep in mind that we're primarily evaluating bone unless we are looking at a MRI scan. If we are looking at MR imaging, that is the sole indication for looking at soft tissue abnormalities, whereas you might be able to see some degree of soft tissue abnormality or pathology via CT, and to even a lesser degree via X-ray. But for the most part, you're going to see the bones when we're looking at a radiographic view of the spine. So in order to transition into that, it's good to think about bony structures and even the histologic appearance of bone. So remember that bone consists of both compact as well as cancellous or trabecular bone. So the compact bone is the cortex of the bone, a cortical bone. It's the outer kind of shell that's very, very strong, very sort of dense type of bone, whereas the medullary bone or cancellous trabecular bone is where the marrow cavity, or is going to be near the marrow cavity, but it has these trabeculae, it's trabeculated, and so it doesn't have nearly as much strength as what compact bone does. And you want to keep in mind the cortical medullary junction, also called the cortical line, when you're evaluating bone radiographically. You also want to be thinking about an increase in bone density, which is known as sclerosis, versus a decrease in bone density, which is known as osteopenia. We've all probably heard of osteoporosis, but osteopenia is simply defined as a decrease in bone density, where osteoporosis is where that decrease in density reaches a certain point. So the downside of using conventional radiography to evaluate bone mass is that 50% of the bone mass has to be lost before it's actually recognizable by conventional radiography. So X-rays and CT are not particularly good for evaluating bone density. There's other modalities that are much better than that. So this is just sort of a caricature drawing of our cancellous bone or trabecular bone versus, so that's what's kind of colored, this reddish color on the inside. Compact bone you can see on the outside, so it's a cortical bone, and then you can actually make out the medullary cavity here, right, in the middle shaft of, in this case, the femur. So looking at a superior view or a cross-sectional view of a vertebra here, we can look at, or we can make sure that we are able to identify a number of the different structures on it, which we'll do here in a little bit. But first, just note the difference in the cortical bone versus the trabecular bone. So there's a very clear difference between the two. So you can see, like in the body right here, this kind of mottled or dotted appearance that you see there, that's going to be the medullary bone, whereas the compact bone you can see out here on the outside, which is a hyper intense region of the bone. And generally, as you move back here into the posterior region of a typical vertebra, that's where you see that the bone tends to be more dense or of a cortical nature at that point, whereas especially the body and perhaps to a lesser degree sort of the pars interarticularis region, that's going to be more of this medullary bone. So the vertebral column, just to review, remember that there's going to be 7 cervical vertebrae, 12 thoracic, 5 lumbar, and then the 5 fused sacral, and there's usually 3 to 4 fused coccygeal vertebrae. So that leads us to a total of 33 vertebrae, and there are 23 intervertebral or IV discs located in between the adjacent vertebral bodies, and that stretches all the way from C2, C3, all the way down to L5S1. So remember that there is not intervertebral disc in between C1 and C2, so that's going to be the atlas and the axis, but there are from C2 all the way down to the L5S1 junction. And remember that the spinal cord itself extends from the foramen magnum all the way down to L1, L2, and then finally with the intervertebral foramina or the neuroforamina in between adjacent vertebrae where the spinal nerves exit, these also are going to contain blood vessels and fat in addition to the spinal nerve. So looking at a drawing of the vertebral canal or the spine, we can see the vertebral bodies located anteriorly, and then the intervertebral spaces, which are filled with the IV discs in between each of the adjacent bodies of vertebrae. Here we can see the spinous processes. So this is a posterior view of the spinal column, and then emanating out laterally from the laminae and the pedicle. We can see right here the transverse processes of the vertebrae. So these are going to be somewhat challenging to pick up on imaging. I mean, you can certainly see them, but you do have to look closely to be able to appreciate them. So keep that in mind when you're looking at conventional radiography of the spine, that you're going to have to look pretty carefully to be able to identify the transverse processes. Here's a lateral view where, again, you can appreciate the vertebral body and the intervertebral space with the disc. You can see the intervertebral foramen, again, in between the adjacent vertebrae, and then the spinous processes in the various regions. You do want to pay quite a bit of attention to the shape and the orientation of the spinous processes. So you can see, especially in the thoracic region, where they have this inferior posterior orientation to them. So looking at the unique features of the cervical, thoracic, and lumbar vertebrae, we can see obviously the cervical vertebrae are quite unique. The C1 and C2 are going to be even unique from the other cervical vertebrae, but the rest of them, C3 through C7, these are going to have transverse foramina, which are the only vertebrae that have that. You can see this relatively small vertebral body, and then a bifid spinous process for a number of them. Here we have the thoracic vertebrae. Remember that their spinous processes largely are going to be facing downward, kind of in a down and diagonal direction. So it's a posterior inferior directionality to the spinous processes. You can appreciate the size of the vertebral body, and you can also appreciate the laminae here and the pedicles on either side, as well as the transverse processes, which, remember, there's going to be ribs coming out and forming a joint with the transverse processes as well. So you should be looking for ribs anytime that you're looking in the thoracic spinal region. And we can see the lumbar vertebrae, where you have these very, very large, quite robust vertebral bodies, and then we can see obviously the pedicles and then the laminae, in addition to some of the other features coming off, including the mammillary processes, the transverse processes, and the spinous processes. And then remember, the center region is actually known as the spinal canal, since that's where the spinal cord is located. And then down here we can just appreciate the lateral view. So again, you get a good sense of the orientation of the spinous processes here in the thoracic region, and then same thing in the lumbar region, where you have these sort of larger vertebrae or spinous processes of the vertebrae that are also oriented somewhat in an inferior direction in the lumbar region. So looking at a computer-generated model of the vertebrae here, we can see the different regions identified. So again, the body, the pedicles, which attach to the body. Then we have the spinous processes back here that are attached to the pedicle via the laminae. So you can see these are laminae. So we hear laminectomy. That's referring to removing or cutting through the laminae in order to allow us to remove the posterior aspect of a vertebra. So in this case, the spinous process, and so that you get a much better view of the spinal cord in doing so. You can see the articular facets. So there's going to be an inferior articular facet and a superior articular facet for most of the vertebrae, and then these are formed by inferior and superior articular processes. So here in purple, the vertebral bodies are highlighted, pedicles are highlighted, transverse processes, inferior articular processes, superior articular processes, and the laminae. And then in between the laminae, we have what's known as a pars interarticularis. So here we have the superior articular process, here's the inferior articular process, and in between the two, that's going to be the pars interarticularis, which is oftentimes at risk, especially with repeated trauma, jumping from height. So in gymnasts, as well as in a number of different sports, injury to the pars interarticularis is not uncommon. And we'll talk a little bit more about that a little bit later on, especially relative to what's called the Scotty dog sign. And again, here we have the spinous process in purple. All right, so here we also have, once again, the labeled regions of a vertebra, so make sure that you're really comfortable with each of those different regions, including the vertebral canal or foramen here in the midline. And we also, in radiology, we break down the vertebrae into what we call anterior and posterior elements. So you can see the anterior element is simply the vertebral body, and then the intervening intervertebral discs or IV discs, and then the posterior elements you can see comprise the pedicles, laminae, transverse, and spinous processes. So here we have a real in vivo image of a spine, or in this case, just of a single vertebra, and so we can appreciate the different structures. The solid white arrows represent the pedicles, B represents the body of the vertebra, C represents the spinal foramen or spinal canal, and then back here we have the laminae shown by these dotted white arrows. All right, so now we have a AP view of a spine, and so we can see hopefully that we are in the lumbar region here. You can see the 12th rib coming off of the T12 vertebra. So that makes this one L1, L2, L3, and then L4 would be below that. And you'll notice these solid white arrows are pointing out the pedicles. So the pedicles look like almost like these two eyes that you'll see in the lateral aspect of the body. And then what I consider the nose right here is going to be the spinous processes, and so it kind of makes a little bit of a face that you see right there between those structures. And then up here where this black arrow is located, this is pointing out a facet joint. So typically you can see multiple facet joints located in between adjacent vertebrae. And so again, here's one here, here's another one down here. So you get a good sense of what that should look like. Now looking at another AP view of the cervical spine or the C-spine, note that you'll rarely be able to see C1 and C2 on an AP view of the C-spine. It doesn't mean that you won't, but in general, the mandible is going to get kind of overshadow it, so it's going to make it very difficult to be able to appreciate C1 and C2. In this view, you should also usually see T1 with the first rib, so you want to be careful about or be aware of cervical ribs, so it's really easy to miss those. We'll talk about that here momentarily. The transverse process of C7 is usually either transverse, so directly moving left to right or right to left, or sloping down slightly. Whereas the transverse process of T1 typically slants upwards. So I want you to take a minute in this image and just appreciate what those transverse processes look at, like kind of compare and contrast the transverse processes of C7 compared to T1. And hopefully you're able to see the more transverse orientation of the C7 transverse process versus T1, where you can see that the transverse process is pointed sort of upward, and so it has that upward sloping directionality to it. And then finally, you want to check for symmetry anytime that you're looking at the spinal column. So in this case, hopefully you've noticed that there is some asymmetry in the image, and so you can see right over here where we have a loss of symmetry, and that indicates in this case a cervical rib. So this C7 has a small cervical rib attached to it. I put this in here just to remind you that it's probably a good idea to go back to complete anatomy and just play around with the skeleton, be really looking at the vertebrae, and be thinking about if you'd be shooting an image from anterior to posterior and or posterior to anterior and or from a lateral or oblique view, and be thinking about what do these things look like when, or what should the bony structures look like when doing so. And I think that'll help to be able to interpret these images. So here you can kind of get a sense of what these different structures are going to look like, and especially the important transition line. So in this case, moving from C7 down to T1, where now you can see the ribs, you can again see kind of the slight upsloping of the transverse processes, which you don't see in the cervical region. So this kind of allows you to reinforce some of the way that the anatomy appears in the spinal column by looking at complete anatomy. So now looking at a lateral view of the C-spine, so of the cervical spine, generally you're going to be able to see the superior border of T1, so you want to keep an eye out for that. That's usually going to be the lowest of the vertebrae that you can make out on a lateral C-spine view. And then you should also notice a smooth continuous lordotic curve traveling along the C-spine when you look at it from a lateral perspective. So that yellow line there represents that smooth continuous lordotic curve that you should expect to see. You'll also note that the prevertebral soft tissue is usually about a quarter diameter of the vertebral bodies of C1 through C4, and then it triples at C4, C5. So again, you have relatively little prevertebral soft tissue up more proximally along within the spinal column, but as you move down further and further, that prevertebral soft tissue expands dramatically, and so you get this rapid expansion of the soft tissue there. Oh, and then remember that disc spaces should be similar level to level. So when you look at each intervertebral disc, you should notice a huge, significantly different spacing from one level to another. All right, and then again, here we have another view from complete anatomy, looking at a lateral view, and so this just kind of gives you a sense of what you're looking at. So again, you can see C1 with its process right here. You can see Z2 and how it sort of is somewhat different than what C1 looks like, and so you can come over here and see the same basic appearance, which is important to be, again, kind of getting in your head exactly what this anatomy looks like, so that when you look at a scan, you're able to identify some of the more subtle features of that image. As an example, you can see in this view very clearly the facet joints, or the zygapophyseal joints, are really quite obvious, but when you look at this image, they're not nearly as obvious. But if you know where to look for them, then you're able to pick them up here quite well. There's also something known as the pre-dens space, which is going to be the slight space that's located in between the dens and the posterior margin of the anterior arch of C1. And so you can see that in adults that should typically be less than 3 millimeters. If it's greater than 4, that indicates that there's likely been an injury of the transverse ligament. So the transverse part of the cruciate ligament has likely been affected. And this usually is indicative of what we call a Jefferson's fracture, which is a burst fracture of C1. So again, if you see that the pre-dens space is expanded, it's larger, so that's what these arrows are pointing out. If you notice that this pre-dens space is significantly enlarged, that indicates that there's likely been a Jefferson fracture at that location. So here we have a view of the cruciate ligament. You can see the tectorial membrane that's going to be coming up and attaching to the base of the occipital bone. This is the distal continuation, or the superior continuation of the anterior the posterior longitudinal ligament as it's coming up along the posterior surface of the vertebrae, and then it sort of expands as you ascend up into this upper cervical region. And then you can see the transverse ligaments coming across, attaching to the lateral walls of C1 from the dens. And then there's also these alar or check ligaments that attach from the dens up to the base of the occipital bone, right around the foramen magnum. And then finally, we have the apical ligament coming out directly off of the tip of the odontoid process, also known as the dens. And so here we have another view of what this sort of looks like. And so you get a sense of the basion of the occipital bone. You can see this is again a sagittal section, so you can see where this transverse ligament of the atlas has been cut. And then we can see anterior arch of C1. Here's the dens right here. And then you can see the anterior longitudinal ligament located anterior to that, whereas the posterior longitudinal ligament is located immediately posterior to the vertebrae. And then again, the distal, or the superior most part of that, is called the tectorial membrane, that has a couple different layers and helps to also reinforce the joint here in between the dens and the occiput. Another image or drawing of this region, so you can see this all represents C1. So you can see the posterior arch back here, the anterior arch up here, transverse processes with the transverse foramina, and then right here in the midline you can see the dens with the alar ligaments coming up off of it to try to help reinforce it. So one thing that you want to be looking for is to make sure that the anterior longitudinal ligament line, which is also what we call the anterior vertebral line, right along here, is smooth and continuous. So there shouldn't really be any obvious deviation from drawing a smooth line along the anterior vertebral line. And similarly with the posterior line here as well, this should form a continuous, relatively straight or continuous line, so smooth and continuous along its entire path. And then finally, we have what's called the spinal laminar line. So this is going to be drawn right along the laminae, right where you can see the spinous processes coming out here. So hence spinal laminar. So spinous process and the laminae are going to help to form this line. And again, that should be relatively smooth and continuous, and they should all be forming a lordotic curvature.